Now, an expert at NC State says we could see major disruptions to daily life for several weeks as the Omicron variant spreads.
Yeah, from hospitals to hospitality, she tells us that many aspects of society are going to be impacted. Capitol reporter Michael Highland is live in Raleigh for us tonight. Michael, we're already seeing a strain on health care because of this.
Right, a team of experts that's local and been advising the CDC has warned we could see a record number of people ending up in the hospital during this surge. But one of them told me today it's not too late to lessen the severity of that. With Omicron surging, additional viruses spreading, and people needing care for other reasons, hospitals in North Carolina are filling up again. Dr. Julie Swan is a health systems expert at NC State, leading a team advising the CDC about the trajectory of the pandemic.
When hospitals are full and when there are not enough staff, then care for all patients could suffer to some extent.
Her group warned weeks ago that North Carolina could see record numbers of people in the hospital during this latest surge. That number has climbed quickly, with DHHS reporting Friday more than 3,400 people are being treated for COVID-19, about 500 fewer than the peak last January. She says it's especially concerning as some hospitals deal with staffing shortages.
What we're seeing in North Carolina is similar to what we expected. Cases are going up quite quickly.
She told me members of her own household recently tested positive, but all are vaccinated and have their booster shots if eligible.
In that kind of situation, the disease outcomes can be milder.
While she's concerned the surge will last into February, she says more people getting the booster shot and wearing masks could lessen the impact.
But this is hitting everywhere across the nation almost at the same time, and so the absenteeism is really driving a lot of disruptions.
Governor Roy Cooper addressed this Friday, saying he's hopeful in time this will move from a pandemic to an endemic.
We understand that this virus is going to be with us for a long time, but that we need to make sure that we can lead normal lives.
Dr. Swan pointed out that on average, people who do end up in the hospital are staying there for a shorter period of time than during the Delta surge. She also said with teenagers becoming eligible for the booster shots now, that could help with providing a greater degree of protection for more people. Live in Raleigh, Michael Highland, CBS 17 News.
All right, Michael, thank you. We're just ready to get over all of this, but
Yes,
we
indeed.
appreciate the information.
All right, we do have a consumer alert for you tonight.